Here we introduce you to the basic guidelines on measuring techniques for lymphology garments. In the first step, we want to show you the procedure for the lower limbs. Hygiene is extremely important when directly in contact with patients. Remove your watch and all jewelry before taking measurements, as pathogenic organisms can colonize these. This will also prevent you from causing the patient's possible injury. Make sure your workstation is always clean and tidy, and disinfect the equipment you need. Clean and disinfect your hands before and after taking measurements. The yellow Medi measuring tape has been designed especially for measuring patients for flat knit compression garments. It is longer than tape rules, which allows larger circumferences to be measured. It is also wider and has rounded edges to make it more comfortable for the patients. The loops ensure a reliable grip, even when pulling more tightly. When measuring very large circumferences around the torso, the measuring tape can be threaded through one of the loops to form a ring. Use a skin-friendly pen with a soft core for marking the measuring positions in order to prevent skin injuries, for example, a kohl pencil. Make sure you sharpen it each time before use. A relaxed position is important for the patient's well-being. A suitable treatment couch is essential for this. Measure the circumferences A to F with the patient lying down. The patient only stands up before measuring the circumference of the thigh. Measure the remaining circumferences G to T with the patient standing. Measure all lengths with the patient standing, following the shape of the body up to measuring point K1 along the inside of the leg. Measure the foot lengths with the patient standing and weight bearing on that foot. Please make sure you take all the measurements with the patient standing quickly and without any interruptions. Patients with lymphoedema should avoid standing without compression. Measurements to the nearest 5 millimeters are sufficient for the legs. Measure flat knit compression garments accurately under tension. The amount of tension required when taking the measurement depends on the respective measuring point. We differentiate between 3 different measurements. 1. The skin measurement. Here, the actual circumference is measured with the tape held loosely. 2. Pull the tape to the first point of resistance. Here, the measurement is taken under tension while pulling gently. 3. Measurement under full tension. For this, the measurement is taken under forceful tension, thereby compressing the tissue completely with the measuring tape. Normally, you will find 2 columns for entering the circumferences in Medi's measuring forms. 1. The skin measurement. This is used to help document the patient's data and the course of his or her progress. These measurements are important for you as a customer should it be necessary to make any complaints about the fit. They help us evaluate the complaint properly. The skin measurements are not relevant for Medi when making the garments, although we will need the skin measurements if you want to work together with us to solve a fitting problem. 2. The measurement under tension is the measurement you order. This is where you enter the measurements, which we will use to make the garment, even though there are some measuring points that are not measured under tension. The golden rules of measuring. As a rule, flat knit compression garments are consistently measured under tension. Do not measure under tension directly over a joint, for example, measuring point Y. Never measure the circumferences directly in a skin fold, always slightly over it. Always measure leg lengths following the shape of the body along the inside of the leg. First, decide on the measuring positions and mark these on the inside of the leg. For measuring point A, mark above the metacarpophalangeal joint of the big and the little toe, representing the base of these toes. Measuring point B marks the narrowest point of the ankle. It is about 1 finger's breadth above the medial malleolus. To find measuring point B, Run your index finger along the bony part of the medial malleolus to the point where the structure becomes soft. If the patient has visible edema, this point is where the edema starts, never in the joint fold. B1 lies over the distal insertion of the deep calf muscles. For measuring point C, measure directly over the muscle belly at the widest part of the calf muscle. Measuring point D is about 1 finger's breadth below the medial course of the pit of the knee. Alternatively, you can mark the skin 2 fingers' breadth below the kneecap, at the level of the anterior border of the tibia. Our tip: it is often difficult to find the actual measuring positions by inspection or palpation. It works best if you first find measuring positions B and D as shown above, and then measure the distance between the 2 points and divide these into 3 equal parts. This will help you find all the measuring points for the calf simply and reliably. Mark measuring point E over the middle of the patella. In some cases, we measure circumference E with the patient standing. For example, shapes in the area of the thigh that spread out widely, or if the knee area is covered partly or completely by soft tissue overhangs. In this case, mark the measuring point above the patella where the accumulated tissue starts. Measuring point F defines the middle of the thigh between the middle of the patella and the inguinal fold. If you find the measuring point with the patient lying down, mark it slightly above the actual middle of the thigh. Tissue easily slips down when the patient is standing. This also shifts the mark downwards. If you mark the measuring point higher when the patient is lying down, the distances between the knee and the inguinal fold are then equal. Measuring point G lies over the widest part of the thigh, 2 fingers' breadth below the groin, or directly below the gluteal fold. For measuring point K, measure the circumference around both thighs. You do not have to mark this. It is at the same level as measuring point G. Measuring point H defines the widest part of the pelvis or bottom. Measuring point T marks the border of the panty top. It is always above the iliac crest. The larger the torso, the higher the measuring point should be. Pass the measuring tape circularly around the body at the height of the ribs. Slip it downwards until it stops by itself between the iliac crest and the costal arch. Mark this point both at the front on the abdomen and at the back of the torso. Measure circumference A by passing the measuring tape slightly oblique over the highest points of the metatarsophalangeal joints of the big and little toes. Take the measurement under moderate tension by molding it into the soft tissue of the dorsum of the foot. Make sure that only the soft tissue of the dorsum of the foot is compressed. Do not press the bony structures together. If the patient cannot tolerate pressure over the forefoot area because of a sensitive hallux valgus or a Taylor's bunion, you do not need to measure under tension here. However, the fabric over the dorsum of the foot may then form wrinkles and slip backwards. Our tip: if the patient has a pronounced hallux valgus, measure circumference A proximal to the line of the metatarsophalangeal joints. To do this, run the measuring tape loosely around the foot without reducing the circumference. For circumference Y, pass the measuring tape circularly around the heel and instep. For the largest possible circumference, the patient must pull the foot up during the measurement. Make sure that you include overhanging soft tissue when measuring the circumference. Avoid measuring in the ankle skin fold. Never measure under tension here. Every reduction of the circumference at measuring point Y increases the pressure over the tendon. Measure circumference B under full tension. Pass the measuring tape circularly around the marked level. Now take advantage of the leg's own weight by pretending to lift it with the measuring tape. The leg should thereby remain on the treatment couch. Hold this tension. Then close the two ends of the measuring tape and read off the circumference. Enter the measurement on the measuring chart. Measure circumferences B1 likewise under full tension. Pass the measuring tape circularly around the marked level. Now take advantage of the leg's own weight by pretending to lift it with the measuring tape. Hold this tension. Then close the two ends of the measuring tape and read off the circumference. Measure circumferences C exactly like the circumferences B and B1. Pass the measuring tape circularly around the marked level. Now take advantage of the leg's own weight by pretending to lift it with the measuring tape. Hold this tension. Then close the two ends of the measuring tape and read off the circumference. The degree of tension exerted for measuring point D depends on the length of the garment. Circumference D is the final measurement for knee socks. Do not let the garment constrict the tissue or slip down. Reduce the circumference measurement for knee socks by pulling the tape tight to the first resistance of the tissue. Pass the measuring tape circularly around the limb at the level of the mark. Pull carefully on both ends of the measuring tape until you are certain you can feel the resistance exerted by the tissue. Our tip: you will feel the resistance best with your eyes closed. The degree of tension exerted for measuring point D depends on the length of the garment. With compression garments that extend above the knee, establish a good connection between the fabric and the tissue, but give the knee joint room for movement. Measure under tension here as well. The intensity of the tension should lie between the first resistance and full tension. Pass the measuring tape circularly around the limb at the level of the mark and pull carefully on both ends. Can you feel the resistance exerted by the tissue? Then make the measurement a little bit tighter, but not to the point of full tension. You will feel the optimum point best if you close your eyes. To measure circumference E, the patient must bend the knee to between 30 and 45 degrees. Do not run the measuring tape directly in the hollow of the knee or in a skin fold. Position it 1 finger's breadth above the hollow of the knee and 2 fingers' breadth above the kneecap. The measuring tape should be positioned slightly oblique. Then, hold the outer end of the measuring tape loosely on the leg. Mold the inner end firmly into the tissue. If a patient has soft tissue overhangs in the knee area, The circumference E should be measured with the patient standing so that the garment has sufficient volume. This is because the tissue of the thigh slips down and increases the circumference in this case. Run the measuring tape circularly around the leg above the patella where the accumulated tissue starts, thereby making sure that the patient has a firm footing. Pull the measuring tape into the tissue at the back of the leg and close both ends at the front of the leg under full tension. Measure circumference F under full tension. Pass the measuring tape circularly around the marked level. Again, take advantage of the leg's own weight by pretending to lift it with the measuring tape. The leg should thereby remain on the treatment couch. Hold this tension. Then, close the two ends of the measuring tape and read off the circumference. Measure the circumferences above measuring point G with the patient standing, thereby making sure that the patient has a firm footing. Take these measurements under tension as well. Run the measuring tape around the widest part of the thigh. The intensity of the tension should lie between the first resistance and full tension. Pull on both ends of the measuring tape until you are certain you can feel the resistance exerted by the tissue. Make sure that the measuring tape presses evenly into the tissue of the thigh. Reduce the measurement slightly beyond the first resistance, but not to the measurement under full tension. Our tip: you will feel the optimum point best if you close your eyes. For circumference K, the patient needs a firm footing with the feet hip-width apart. Place the measuring tape at the same height as for measuring point G, namely circularly around both thighs just below the bottom. Ask the patient to lean back slightly against the measuring tape. Hold this tension and close both ends of the measuring tape firmly at the front. Please note, the tension of the measurement under tension must be the same for all three circumferences. The two leg sections will be connected to the panty top around this line. The two leg sections will only be compatible with each other when the garment is made up if their sizes are in equal proportion to circumference K. When measuring circumference H, make sure the patient has a firm footing with the feet hip-width apart. Pass the measuring tape circularly around the body at the widest part of the pelvis and measure under full tension. Please note, if you measure circumference H too loosely, wrinkles will form and increase pressure in the panty top region. If the patient cannot tolerate pressure, the patient needs a lower compression class. To measure the border T, pass the measuring tape around the torso between the iliac crest and the costal arch. Do not measure in a skin fold. Slide the measuring tape upwards out of the skin fold and pull it tight around the body without tension. Measure all leg lengths along the inside of the legs. Have the patient stand in front of you with the feet hip-width apart. Place the measuring tape with the 0 mark on the floor and hold it with your thumb. Read off the measurements and enter them in the measuring chart. Then, hold the measuring tape at one measuring point after the other along the contour of the leg, close to the body, from the floor up to measuring point F. always respect your patient's sense of intimacy. Measure length G from above downwards. This way you can avoid touching the patient's pubic area with your hand. Bend over the measuring tape at the 0 mark and hold this on the mark for measuring point G. Now run the measuring tape along the contour of the inside of the leg down to the floor. Please note, length G is of secondary importance when making up compression garments from MADI. Length K2, the overall length, is important. The rear leg length K2 is the most important length for thigh-length stockings and all pantyhose variants. Measure this length along the inner back of the leg. Bend the measuring tape over again at the 0 mark and place it at the apex of the gluteal fold at the transition to the groin. Run the measuring tape close to the body down along the contour of the leg to the floor. The whole front leg length, K1, must be only measured for the accessory extra leg length. The difference between K1 and K2 gives the height of the extra leg length. K1 is at the height of the lower border of the pubic bone. In order to avoid unnerving the patient, explain the position and let the patient show you where it is. Bend the measuring tape at 0 and slide it from the border of the pubic bone directly into the inguinal fold. Measure the length of the inner contour of the leg from here to the floor. Make sure that the line starts with the lower end of the bony structure of the pubic bone and not the overlying tissue. Measure length H along the outside of the body. Hold the measuring tape on the mark at the level of the widest point on the pelvis. Measure closely to the body along the contour down to the floor. Measure length T along the outside as well. Hold the measuring tape between the iliac crest and the costal arch. Pass it close to the body along the contour down to the floor. Please note, at present MADI only needs this measurement for thigh-length stockings with waist attachment. Measure the front panty top length, K1T, starting from measuring point K1 in the groin and going upwards to the optimum front border of the panty top. Start with the 0 mark of the measuring tape in the groin and pull it tightly upwards. Mold the abdominal tissue upwards as you go. The larger the torso, the higher the optimum top border. With very pronounced abdomens, it is ideal if the top border of the panty top comes to lie just below the chest. This makes sure that no abdominal tissue folds over the fabric and pushes it down when the patient is sitting. For patients with a flat stomach, the panty top can end at the level of the navel, just below the abdominal fold line caused by sitting. For the rear panty top length K2T, hold the measuring tape in the transverse gluteal fold. Now measure vertically upwards to the marked point between the iliac crest and the costal arch. Hold the measuring tape tightly against the body. Make sure that the panty top does not slip down because the back of the torso grows longer when the patient sits or bends forward. So make the actual rear panty top length longer by the width of the waistband. In other words, about 4 centimeters. Enter this final measurement on the measuring chart. An additional length is needed for the accessory elliptical form at E. Measure the length of the hollow of the knee on the back of the leg. Hold the measuring tape directly in the skin fold in the hollow of the knee and measure the contour close to the body downwards to the floor. Please note, the measurement is located between length D and E. If the patient has very pronounced calf muscles, you can measure the length of the hollow of the knee on the inside of the leg. This prevents the ellipse form from being too high. Hold the measuring tape in the skin fold in the hollow of the knee and measure the contour close to the body downwards to the floor. Mady offers two different border variants for the compressive knit over the feet: the oblique border, the straight border. The starting point for measuring all foot lengths is the rearmost point of the heel. Mark the following two measuring positions: measuring point A on the lateral border of the foot directly at the base of the little toe, and measuring point AI on the medial border of the foot at the base of the big toe. Measure the lengths with the patient standing and weight bearing on that foot. You can choose both variants as open toe or with closed toe. For the open straight variant, measure the length from the rearmost point of the heel to measuring point A at the base of the little toe, along with the lateral border of the foot. For the open oblique variant, measure the length along the lateral border of the foot from the rearmost point of the heel to measuring point A at the base of the little toe. Also, measure the medial length from the rearmost point of the heel to measuring point AI at the base of the big toe. The difference between the two measurements gives the oblique border. The procedure for measuring the overall length of the foot is the same for both variants with closed toes. Hold the measuring tape at the rearmost point of the heel and measure the length to the end of the longest toe. As a rule, this is the big toe. In many cases, the second toe is longer. In this case, measure to the end of the second toe. Our tip: if the second toe is longer, choose the special request "work toes round." Braces attached individually to the panty top can offer additional security of hold. Measure the length from the rear panty top border diagonally to the middle of the shoulder. Measure from the middle of the shoulder straight down the torso to the front panty top border. If you have further questions about the different steps of measuring or our products, please contact your Mady customer service.